Do you have high ferritin? Perhaps you discovered elevated levels on routine blood work. Or you were searching for solutions for symptoms like fatigue, joint pain, abdominal pain, or even ED, and you learned your ferritin is high. Maybe you're unsure if your levels are normal or not. If so, keep watching, because in this video, I'm going to help you get to the root of high ferritin and give you functional medicine strategies you can use to optimize your levels. Before we can dive into strategies for optimizing ferritin, we need to get on the same page about what it is and why it matters, because it does matter a lot, despite the fact that your doctor might not be paying attention to it or even measuring it. Here's what you need to know. Ferritin is a protein that stores iron in your cells, safely transports it in the blood, and releases it when your body needs more iron. To do important stuff, like make the red blood cells that carry oxygen to every cell and system of your body. We need this ferritin protein because while iron is a super helpful micronutrient for your body, free iron is actually toxic to your cells, so it needs to be bound up or buffered when it's stored. That's ferritin's job, to keep a reserve of iron that's ready to go when your body needs it without exposing your cells to harmful free iron. So, when we measure your levels of ferritin in the blood plasma, we get a sense for how much of a backup stash of iron your body has at its disposal, as opposed to measuring iron in your blood directly, which is more common than measuring ferritin. Even if your iron blood test comes back within the normal range, it doesn't necessarily mean that you have the proper amount of reserve iron stored in ferritin, and if that level is too high or too low, it can be a trigger for dysfunction. In the case of high ferritin, it can also be a critical clue to other underlying health problems. Fortunately, ferritin can be measured via a simple blood test, and the optimal range is 70 to 300 micrograms per liter for adult males and 70 to 150 for adult females. Many people, especially females, struggle with low ferritin, also known as latent iron depletion, and it can trigger symptoms like hair loss, fatigue, weakness, headaches, dizziness, anxiety, depression, poor focus, lack of recall, and an overall decrease of brain function. I have another video in my library about that situation if you want to check it out. But what if your ferritin labs come back above the optimal range? First of all, don't freak out. Approximately 1 in 20 people have results outside of the optimal range, and there are several reasons for high ferritin besides rare genetic conditions. One of those reasons being acute and chronic inflammation in the body. That's because ferritin is an acute phase reactant, which means it's a substance that increases or decreases in response to inflammation or infection. Why does this happen? There are a few reasons, but I think it will help to spend a quick minute on what inflammation is and why it happens so you can understand better. Inflammation is a biochemical process that the immune system uses to fight off infections and promote healing of damaged tissue. There are many, many, many facets to inflammation, whether it's short-term or long-term, aka acute or chronic. You might think of inflammation as a bad thing, and it certainly can be a problem if it's poorly regulated or incomplete, but we also can't live without it. Some of the chemicals the body makes as part of the inflammatory cascade are called cytokines, and their job is to act as chemical messengers for the immune system, helping your body know how to respond to an inflammatory threat or trigger. They also help control how much inflammation happens in the body, and they correlate with elevated ferritin. So if your body is producing a lot of pro-inflammatory cytokines, your ferritin may also go up, and for good reason too. Remember that ferritin represents stored iron that's bound up and buffered instead of available in your blood? Well, pathogens like bacteria and viruses like to use the free iron in your body to grow and multiply. So it can be helpful to bind up or sequester some of that free iron as ferritin, making it less available for pathogens. which can result in higher levels of ferritin on your blood tests. Makes sense, right? So if your ferritin is high, you need to investigate and address those potential inflammatory triggers. A few root causes of inflammation that can raise ferritin levels include diabetes and metabolic syndrome, liver disease and drinking too much alcohol, hyperthyroidism, and other autoimmune diseases like rheumatoid arthritis. Some rare causes for high ferritin include kidney disease, cancers like lymphomas or leukemia, Still's disease, and hemochromatosis or iron overload. Hemochromatosis and iron overload happens over time as too much iron builds up in the body. There are two types, one that's caused by a genetic defect, and one that happens as a result of treatments aimed at raising iron, like blood transfusions and oversupplementation. Folks with hemochromatosis most often have both high levels of iron and high ferritin on blood work. That's why it's helpful to test and retest when treating symptoms of low iron. You don't want to push your iron levels too high. Thankfully, it takes a long time to develop problems from iron overload. Most people don't experience symptoms of hemochromatosis until they're middle-aged or older. I generally recommend testing ferritin every 4 to 6 months in order to optimize your levels. Let's say you've worked with your doctor to ensure you don't have iron overload, Still's disease, or cancer, but you still have elevated ferritin. The vast majority of folks fall into this category, and they typically get zero guidance from their doctor. And yet, having chronically elevated ferritin is associated with a higher risk for cardiovascular disease, metabolic syndrome, and certain cancers. That's why it's important to assess and address the root cause of your inflammation. When it comes to further investigation of inflammation, there are other blood tests that might be helpful to have a look at, including C-reactive protein and erythrocyte sedimentation rate, as well as liver enzymes like AST and ALT. But that only tells you the inflammation is present. It doesn't tell you why or how to fix it. That's why I like advanced functional testing, particularly comprehensive gut testing, to get deeper, more actionable data in the case of elevated ferritin. In functional medicine, we recognize that the gut is the major source of chronic inflammation, and it strongly influences the function of both the immune system and the brain, which provides regulation for the rest of the body. And the gut also houses many microbes, including potential pathogens, that can set you up for both chronic and acute inflammation. If your gut's not happy, then nobody's happy. But you can't treat pathogens, parasites, and microbial dysbiosis if you don't know it's there. That's why I offer comprehensive stool analysis testing via a convenient at-home testing kit through my website. And I'll even help you interpret it. I've put details about this option for you in my top 5 anti-inflammatory strategies checklist. It's a free download that you can sign up for via the link in the video description. There are many, many, many ways to reduce your inflammation. So many that there's no way for me to cover all of them in this video. But optimizing gut function is definitely at the top of my priority list. One strategy that doesn't get enough attention doesn't just block inflammation, but helps resolve it. This is especially important when we're dealing with chronic inflammatory problems like arthritis, autoimmunity, and metabolic syndrome. I'm talking about specific pro-resolving mediators, also known as SPMs, or resolvins for short. Remember that I told you inflammation isn't bad as long as it's being regulated properly? Well, part of that regulation means that once your body has taken care of the problem, it's healed the damaged tissue or killed the infecting virus, it's supposed to return to baseline, to homeostasis. And these SPMs play a crucial role in this process, allowing us to bounce back once healing is complete. The good news is that your body makes these SPMs from healthy fats, specifically long-chain polyunsaturated fatty acids. The bad news is that most of us don't make nearly enough of these resolvins, and we use them up at increased rates because of the inflammatory nature of our internal and external environment. Eating processed foods that have low micronutrient density, sitting at a desk all day, not getting enough sleep, carrying around excess fat tissue, failing to compensate for elevated stress. All of these very common and sometimes unavoidable factors can lead to poor SPM status and therefore unresolved chronic inflammation, which we might see as elevated ferritin on blood work. SPMs are relatively new on the scene, having been discovered by a highly respected researcher named Charles Sirhan in the mid-1980s. Dr. Sirhan has even been nominated for a Nobel Prize in medicine for his discoveries, which is no surprise given how many studies show potentially groundbreaking benefits of SPMs for treating conditions ranging from atherosclerosis to fibromyalgia to obesity. If you find yourself dealing with chronic or recurring inflammation, I highly suggest supplementing with SPMs. Whether you're an elite athlete or weekend warrior, you have an autoimmune disease or endometriosis, or you struggle with chronic pain and poor immune function, or you have elevated ferritin, resolving inflammation is a really good idea. But this is one of those instances where the quality of the supplement can have a big impact on your results. The product I recommend uses the exact patented process that Dr. Sirhan developed for extracting SPMs, and it's the only SPM supplement on the market that has actual efficacy data from human clinical trials. A 2021 study also showed a 300% stronger response of white blood cells compared to other SPM products. And for all of the cynics out there, no, I did not get paid to say that. I just want to make sure that if you're going to spend your hard-earned money on a product, that you get a good one. I'll be sure to link to my favorite SPM supplement in the free Top 5 Anti-Inflammatory Strategies download. And I'll also post a link in the video description so you can grab some for a really nice discount through my Fullscript dispensary. Thank you so much for watching. I hope you found this video helpful, and I hope you find the anti-inflammatory checklist useful as well. Be sure to grab your free copy at the link in the video description. If you did happen to get some value from this video, I'd really appreciate it if you'd hit that like button and subscribe to my channel. That way, you'll be the first to know when more videos are published. And it helps other folks who need functional medicine support find my channel too, which is great. Oh, one more thing. If you happen to be intrigued by SPMs and you'd like a deeper dive on these groundbreaking resolvins, be sure to leave me a comment to let me know. If there's enough interest, I'll make a separate video about SPMs for you. I think that's it. Thanks again, and we'll see you in the next one.